So the things that are really going on in the chemotherapy space are trying to work out, as I discussed before, whether we can predict which patients are going to benefit from which drugs. So doing work in the lab where we can take a specimen of cancer and grow it in a petri dish and see whether or not we can predict whether a patient will respond to certain drugs, but in a time frame that suits the patient. Now, these methods are already in existence, but they take several months, which clearly does not suit a patient who's waiting for treatment. So can these methods be sped up and be done in, say, a couple of weeks, which would suit a patient? There are also trials looking at how we can protect the ears, particularly from drugs like cisplatin. And I think it's important to mention that one of the advances that has happened in the last couple of years is a significant improvement in our anti-nausea medication. So even when I was going through my training, delivering cisplatin was very difficult because it's a highly nauseating drug. And so the drugs that we have now, it's a single tablet that's taken on the day of treatment, and almost nobody gets nauseated enough to vomit. And people really just do feel a bit sort of yuck for a couple of days, but then it goes very quickly. And that's been a massive improvement even in the last 5 years.